Hi, everyone, to another Healthy Slice. I am Dr. Alicia of Banfields Professional Medical English, specializing in medical English, OET and IELTS preparation, as well as job interview coaching and personal statement guidance for USMLE matching. You can check us out at promedicalenglish.com, link below this podcast. Today, I'm chatting with Pediatric Surgeon Bazil Brown about those tough scenarios where local work or professional culture are at odds with good practice and ethics. Could be anything from a simple clash with a colleague to clear malpractice, but you've personally witnessed it. What do you do? Dr. Bazil Brown, or more correctly, Mr. Bazil Brown, will share some of his experiences and insights from what can only be described as a truly adventurous international career. First of all, Basil, I'll let you introduce yourself and explain why, as a surgeon, you're more correctly addressed as Mr. Brown and not Dr. Brown.
I started my medical training in Jamaica, where I'm from. I went to the University of the West Indies,
Yay!
did undergrad and postgrad in pediatric surgery. I was given the opportunity to go to England to join their pediatric surgery training program under the guidance of the Royal College of Surgeons of Edinburgh, which I completed. And when you become a member or fellow of the Royal College of any of the UK colleges, your name reverts to the name of your ancestors. The ancestor of British surgeons were barbers, so they're always called Mr. So as a homage to our ancestors, we're all called Mr. or Miss.
So, for listeners who may not be familiar with the system, when you actually hear a surgeon who has been educated in the British system being referred to as Mr., it in fact indicates that they're higher on the food chain in their career than doctor. So you can do a little research and find out where that came from. But Basil, with a career span like yours, can you first of all tell us some of the countries where you've worked?
I worked in Jamaica, of course, for many years, even as a specialist. I worked in the UK for about 5 years, did some consultancy there as well. I was then lured back to the Caribbean, where I worked in Antigua. I worked in Guyana. I'm now in Central America,
Mhm.
and I live in Toronto.
Yep.
But
Yep.
because I've never actually practiced in North America, I'm kind of a knife for hire.
Yeah.
So whoever has a contract open for a pediatric surgeon, they give me a call and I turn up.
All right. And in fact, you also worked in Europe in Malta as
Yes,
well. Yeah.
Malta. I did 2 years in Malta.
Yep.
Yes. Wonderful
Right.
language, wonderful history.
Yeah. Very fascinating history Malta has and crucial in World War II, I believe. In
Yes, it was
yeah.
bombed incessantly by both sides, just trying to get control. It was a lovely um, takeoff ground for both North Africa and Europe.
Yeah.
So somebody wanted it, they bombed it, but they never actually got it. It still stayed British.
Strong forever. So, with a
Yes.
career span as wide as yours, I'm sure you've hit upon some disconcerting, even shocking issues when it came to workplace culture and ethics. Can you share with us maybe one instance that was, so extreme, that it really got to you?
There was a situation in one of my Caribbean stops where, um, because of what we call friend and company or nepotism,
Hmm.
people are allowed to practice without having the proper qualifications. So this fellow
Okay.
who was supposedly an obstetrician gynecologist saw a child in his private practice. Now, the private practice is essential for many people who want to earn just money, 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 money. Saw a 6-year-old boy who had some swollen veins in his anus, not quite hemorrhoids. He
Mhm.
was having diarrhea, so the veins were swollen. He convinced the parents to bring that boy to his house, where his children held down that boy while he proceeded to cut away about 3/4 of the boy's anus as part of a hemorrhoidectomy operation.
Oh my God.
The parents didn't know anything was wrong until about 3 days later when the boy stopped eating, spiking a high fever, had pus coming from his anus, and was quite unwell, screaming in pain. And that's how I saw him in the emergency room in that country. And apart from fixing the boy, physically, we had to have psychological counseling for both him and his parents, emotional counseling. And I set about trying to right the wrong by
Yeah.
reporting this to the medical council of the country.
So how did it all play out first for the so-called professional who did this, and also for the little one, because he likely will have issues now for the rest of his life.
For the rest of his life, yes. We put him on special diets, stool softeners, etc. He may need anal dilatations in the future, which are quite painful or require anesthesia or sedation. His parents are pretty much beside themselves with grief, and they had to be counseled.
Yeah.
The
And
fellow who
probably
did
guilt.
it,
Hmm.
yes, the fellow who did it got a slap on the wrist from the medical council. They were forced into looking into it. It wasn't a spontaneous thing when the report came into them. They were forced to look into it. He was given a couple of months off of work, but then he was back in no time because he knows the right people.
And
He
how did
knows
nepotism, once again, how did that impact you immediately in that scenario, as well as intermediate and longer term when you went into other new international scenarios?
it made me stop and think more about what I'm doing, where I'm going. Do I want to be exposed to this kind of literal nastiness in other
Hmm.
cultures, other societies? Would this be tolerated elsewhere?
Hmm.
So before taking on other contracts, I would call people I knew in the new countries and say, what is the culture like as far
Hmm.
as medical malpractice is concerned? Do you have liability coverage? When was the last time somebody was sued?
Hmm.
It doesn't help a lot because people don't talk about those things a lot.
Hmm.
You have to get there and actually start working before you know actually what's going on.
Yeah. And
But
to
it made me
the
very cautious.
be very cautious. Now, for those of you listening, you might pick up that I know Basil more as just a guest, more than just a guest. Basil and I actually went to medical school together, as he said, the University of the West Indies. Um, Extremely well um, regarded, extremely strong curriculum. We were well trained. We were well trained as clinicians, and we were made aware of governance and standards. So it is not everywhere throughout the region that this occurs, but it is a vast region, and there are pockets where, yes, issues do come up. Do you think, Basil, that anything changed in that particular environment as a result of that incident?
Unlikely. It would have all been swept under the rug and they would have pretended it never happened and just moved on. And the only
Business
one suffering is the patient.
dissipation. Back to business as usual.
Yes.
Now, most IMGs, we hope, will never encounter scenarios that extreme. What about maybe more subtle scenarios that you have encountered where there were still some ethical issues for you, um, but maybe not as extreme?
One of my major bugbears in the practice of medicine is communication.
Mhm.
And I have seen situations where patients who don't speak the native language,
Mhm.
um, they're probably refugees
Mhm.
running into that country to hide from political persecution. And when you ask for translation services for them, first, there are none.
Mhm.
But if you find someone who works in a hospital who speaks that language, you ask them to translate, they may not give all the information that you want
Mhm.
um, with the same kind of sympathy or empathy that you have for the patient. And they'll say to you, they don't need to know that.
Yep.
And that does burn me up. It does burn me up. And communication for me
Mhm.
is vital. It's the center of all healthcare practice.
Exactly. This is why, sorry, and this is why we um, exist, quite frankly, because we are aware of how critical healthcare communication is. Because many IMGs, they're coming from, yeah, multilingual backgrounds, but they're also going into multilingual backgrounds. They may not be familiar with the language, or they may not perhaps have English in an English speaking setting that's good enough. Or it may actually be flipped, and it may be an English speaker with someone who doesn't speak English, and they may ask a family member, for example, to translate, and then actually there are all kinds of issues because the family member may be reluctant because it's a sensitive issue. They may blatantly corrupt what is being said for cultural reasons, or they themselves might not understand and mistranslate. So this is why it is so important that either there are official healthcare translator services, or that the healthcare provider can actually communicate clearly, effectively, and accurately in the moment with the patient or their relatives. So, Basil, you're now senior, experienced, and established. And you can say you have professional security and autonomy no matter where you work. But one of the situations that IMGs can find themselves in is one, being junior, young, perhaps newly graduated, a non-national of the country where they're working, essentially a foreigner, and a newcomer to that particular health care team. And they see something play out that is questionable. And they are actually torn. Do I speak up? Do I not speak up? Especially if it involves a more senior member. Um, IMGs also often come from clinical backgrounds that are very hierarchical, and they're taught never to question a senior. How would you kind of advise and guide? What are your points of view on that kind of situation?
The IMGs must always remember that they too are doctors. They've seen stuff, they've learned stuff, they've trained in a healthcare system elsewhere. If they see something that is blatantly inaccurate, it's going to do harm to the patient, then they need to say something about it. However, there are different approaches. You'll have one person who will be very in your face. So you look at your senior and go, that's wrong. You shouldn't do that. Why are you doing that?
Mhm.
Depending on the scenario, you could be in trouble with that. You'll have the other person who will say, well, whatever you say, just tell me what to do. As long as I get my paper to say I've done my job, then that's fine. You want me to put the knife in further? Yes, I'll put it in further. I'll put your name down if you said so. Then you have the people in the middle who will say, all right, it's not quite right. Let me try to take an academic approach and say, ma'am or sir, my senior, um, I wasn't taught this, or what I was taught was something a little bit different. Can you go over this with me and explain to me your reasoning so I can learn from it? And maybe in that little conversation, then the senior, if they're amenable to talking,
Mhm.
will actually rethink their plan and may actually change it to come
Mhm.
around to what is more standardized. Or they'll explain to you why they're going off standard in this particular situation. At least you can go to bed at night saying, I did the best I could for that patient, and I learned from it.
Now, we our training was very thorough, is very good. However, when we were at medical school, Basil, we did not receive training in this specific area in how to deal with these ethical situations. And I certainly remember feeling the lack of it already in my year 2 internship. Nothing as extreme as yours, but at the time I was in my ONG rotation, and my consultant was one everyone in the hospital universally feared. And she left instructions that a young lady who was on our firm, a tourist in a first trimester with a threatened abortion, was not to be discharged under any circumstances. That was the direction. The only problem was when I came back onto the ward after rounds, I found this lady dressed with her husband by her side, and they were demanding to leave. So I looked at it from a common sense standpoint. I grabbed an AMA form that was an against medical advice form. And
Okay.
in front of a senior nurse, I explained to the patient, reiterated what was said on ward rounds, explained what the consequences could be, and told them if they insist on leaving, we're going to ask them very nicely to sign the AMA form, which they did, and they left. The only problem was the nurse witnessing refused to sign. Instead, she was quite annoyed. She called me a young upstart for daring to go against the consultant, and in front of me walked to the phone and called the consultant and told the consultant what I did. And yes, I was raked across the coals by the consultant in front of the nurse, but I can still hear how dare you in my head. But I simply explain that we cannot physically restrain a mentally and physically capable person against their will. And at least this way, with everything documented in the notes and the form on hand, at least now we were covered medical legally. Now, I was expecting fallout, because after all, I'm an intern, but oddly enough, there was none. So I
Okay.
just pressed on and I kept my head low, went on. But I was all the time very much aware that it could have gotten very uncomfortable for me, especially I was an intern and needed signing off on my 2 years.
Yes.
So I also recognized that that situation actually was not about good patient care. It was actually about ego, the
Yes.
consultant's
Absolutely.
the
Yes.
consultant's ego.
Yes.
So, Basil, do you have any last words you'd like to share, advice to give IMGs from your fantastic career?
All I'd say is be patient. If this is really what you want to do and this is the country you want to do it in, there are going to be setbacks. But if this is what you want to do, then push on. Push on. Take your blows, take your licks, take your cursing, take your reporting, and say, I am going to do this.
Yeah.
I am going to do it. I'll try my best and I
Mhm.
will do this.
Yeah.
Don't be discouraged.
Don't be discouraged. So IMG's listening in to sum up three good points of guidance. If you find yourself in these unethical situations, you can either do what you're told, but document everything. If it's not in writing, it didn't happen.
Mhm.
You can speak up immediately there and then, but remember, there will be an audience to what you're saying, a wider audience to what you're saying, so you run the risk of it not being received well. But if the person you're speaking to is receptive, it could go down well. Or you can reframe it as a teaching moment and ask, why is it being done this way? I want to learn. Could you teach me? And that
Exactly.
also can also go over well. Right. So fantastic talking to you, Basil. I know you have so much more to offer, so don't be surprised if I come back at you again and ask you to be a guest once again.
No problem, Alicia. Anytime, anytime.
And that's it for this round of Healthy Slice, listeners. We at Banfields focus on English speaking settings, unlike Mr. Brown, who has a round the world career. But you can find out more about our services for licensing for the UK and US and language requirement qualifications by heading over to promedicalenglish.com or simply send us a text.